Hello everyone, welcome to my YouTube channel Nursing Education. My name is Pinky and I am a nursing lecturer. So today I am here with a very interesting topic, that is a version. If you have not subscribed my channel yet, so please subscribe it and press the bell icon to get more video. The definition of version is it is a manipulative procedure designed to change the lie or to bring the comparatively favorable pole to the lower pole of the uterus. So the favorable pole is the vertex presentation. So that is bringing down, bring the version. So it is a procedure where it used to turn the fetus from the breech position or the transverse lie into the vertex position or the head down position before the labor begins. And if the version is successfully, then the version make it possible for the woman to try a normal vaginal delivery to avoid the unnecessary intervention. There are four types of version. One is a spontaneous, then external, internal, and the bipolar. So the spontaneous version is the process which occurs naturally or spontaneously. So during the pregnancy till the 36 to 37 week of gestation, baby is moving continuously in the uterus and there is a high chances that baby will turn to the vertex position or the favorable position. The incidence of spontaneous version in the breech presentation is nearly 55% after a 30 week of gestation, whereas about 25% after the 36 week of gestation. And it is more common in the multiparous woman than the primiparous woman, because in the multiparous woman the uterus is stretched and then abdomen is lax. So there is a chances that baby will move continuously in the multiparous woman than the primiparous woman. Another one is external version. So in the external version is done solely by the external manipulation, where the both hand is put on the abdomen and the baby is moving to the favorable position. Another one is internal version. So the conversion is done by the one hand is introducing into the uterus and by the other hand is on the abdomen. Last one is a bipolar version, and it's also called as Braxton Hicks version. So in this, the conversion is done by the introducing one or two fingers through the cervix and by the other hand on the abdomen, and the baby is moving to the favorable position. The external cephalic version. So external cephalic version is done to bring the favorable cephalic pole into the lower pole of the uterus. So in this procedure, the fetus is rotated externally from a breech presentation or the transverse lie to the cephalic presentation, which make it possible to try for the normal vaginal delivery and to avoid the unnecessary intervention. So here in the picture you can see that both of the hand is present on the abdomen and the baby is rotating from a breech presentation to the cephalic presentation. The two indication of external cephalic version, that is a breech presentation and the transverse lie. Here you can see in the figure that in the breech presentation, buttocks is on the lower pole of uterus, whereas in the transverse lie presentation is the shoulder. And in these two conditions, it is difficult to have a normal vaginal delivery, especially in the transverse lie. Because of that, the fetus is rotating from a breech presentation or transverse lie to the cephalic presentation to have a normal vaginal delivery. Procedure of external cephalic version. In breech presentation, the maneuver is carried out after 36 weeks in the labor delivery complex, and there are advantages of performing external cephalic version at term. And these are, by this time, a spontaneous version will occur in many cases. If any complication occur during external cephalic version, the delivery could be done by cesarean section as the baby is at term. And tocolytic drugs should be used, that is a torbutalin 0.25 mg subcutaneous, to inhibit the contraction of myometrium, a smooth muscle cell, and to relax the uterus so that perforation or rupture of uterus can be avoided during the procedure. In general, success rate of external cephalic version is 60%, and the use of tocolytic drugs increases the success rate of external cephalic version. And during the procedure, real-time ultrasound examination should be done to see the status of the fetus and the rotation of fetus as well as the uterus of the woman during the procedure. Before the procedure, reactive non-stress tests should be done to know the fetus activities and the status of the fetus. Also, before the procedure, woman should be asked to empty her bladder, and also she should ask to lie on her back with the shoulders slightly raised and the thighs slightly flexed, and you should ask the woman to expose her abdomen fully. And before the procedure, you need to check the presentation position of the back and the limb are checked, and then FSS are sculpted of the fetus. Actually, a step of external cephalic version. So here you can see that forward roll movement, and there are 4 steps of external cephalic version. In the step first, you can see that the baby is on the breech presentation, and the baby is mobilized using both hands toward the iliac fossa, where the back of the baby is present. And by the right hand, the podalic pole is grasped, whereas by the left hand, head is grasped. In this step second, the firm pressure should be applied to the head and the breast in the opposite direction to keep the trunk well flexed, which facilitates the version, and the pressure should not be forcible. The pressure should be intermediate, it should not be continuous, to push the head down toward the pelvis and the breast toward the fundus to until the lie become the transverse. So in the step third, hand is now changed one after other to hold the fetal pose to prevent the crossing of the hand. So here you can see in the step first and second that a right hand is on the podalic pole or the buttocks, and whereas the left hand is on the head, and in the first and second step, and in the third step here you can see that the hand has changed and the head is grasped by the right hand, whereas the left hand is used to grasp the podalic pole or the buttocks of the baby, and the intermittent pressure is exerted till the head is brought to the lower pole of the uterus, and that is a cephalic presentation. After the procedure, you have to take a reactive non-stress test, and then you have to see whether the fetus is having bradycardia, and there may be the undue bradycardia due to the head compression, which is expected to settle down by the 10 minutes. If, however, fetal bradycardia persists, the possibility of the according tagment should be kept in the mind, and in such case, reversion may have to be considered, and again the baby should be turned to the breast presentation. And the women should be observed for at least for about 30 minutes, and to allow the FSS to settle down to the normal, and also you have to note is woman is having any vaginal bleeding or any evidence of the premature rupture of membrane is present. After the procedure, following instructions should be given to the woman. So first one is follow up to check the correct position. So we need to advise the woman for the follow-up to check the corrected position that has been made during external cephalic version. And second one is to report to the physician if there is a vaginal bleeding or escape of lycopectomy or labor started. So in this condition, woman has to report to the physician. And third one is RH negative non-immunized women must be protected by the intramuscular administration of 100 mg anti-D gamma globulins. If the woman is RH negative blood group, it means that the woman is having A negative, AB negative, B negative, or the O negative blood group. In that case, woman has to given intramuscular administration of 100 mg anti-D gamma globulin to prevent the baby from RH incompatibility condition. The external version in the transverse lie. So you have seen in the external cephalic version that the baby was in the breech presentation, and then baby was brought to the transverse lie and then to the cephalic presentation. But this is a much easier than that, because baby is already in the transverse lie. So the baby has to brought to the cephalic presentation by doing one step, and then in this the intermediate pressure should be applied till the head is brought to the lower pole of the uterus. And in this version, the association of placenta previa or the congenital malformation of the uterus should be excluded, because in the placenta previa or congenital malformation, there is a chances that baby is on the transverse line. So to avoid the further complication, you need to identify whether the woman is having the placenta previa or any congenital malformation that make the baby on the transverse line. Another one is the external podalic version. So the external podalic version is done in case where the external cephalic version fail in the transverse line, or in the case of the second baby of the twins. So here you can see that baby is in the transverse line and the buttocks is brought down of the fetus. So in case where the baby head cannot be brought to the lower pole of the uterus, in that case the baby buttocks is brought to the lower pole of the uterus. Thank you for watching. Please like, subscribe and press the bell icon to get more videos.